going on, guys? Welcome to Barrookie. In today's video we're going over functional anatomy part 4 and we're going to discuss the scapula and the shoulder joint. So why are we going to see this together? Well, because if you have the shoulder joint which can move in directions like this, we also have the scapula which is going to extend the movement of the shoulder, and that's why these two go together so well, and obviously they're almost at the same place, so that makes a lot of sense to cover these both. So we're going to start off with the shoulder joint because that has a limited range of motion, and then we're going to see the extension of that range of motion with the scapula or the shoulder blade. Now, as I said in the previous video on the hips, we are going to see things in a very black and white manner. We're going to look at the planes specifically because they are going to show a very distinct movement pattern, and we're going to use very distinct muscles in that plane of motion. So if this is a sagittal plane and the frontal plane is here perpendicular to it, we will discuss the muscles of both of these planes, but note that there's a vast degree of movement in between those extremes, and that is going to be covered with the muscles of both of these planes. So know that this is more of an understanding of how the muscles work, and each and every movement is a combination of two planes or three planes combined. In the sagittal plane we have shoulder flexion and shoulder extension. Shoulder flexion is moving your shoulder or moving your humerus or your arm upwards. Extension is driving your arm backwards. Then we have adduction and abduction in the frontal plane. So adduction, so you add is bringing your arms close to your body. Abduction is bringing your arms further away to your body. The transversal plane is one that has a little bit more movement, and here we have horizontal adduction, so it's really like hugging. Horizontal abduction is also like flying a little bit. Then we have internal and external rotations. Awesome sauce! Now, let's dive into the sagittal plane here. The sagittal plane where we have flexion, so moving our arm upwards, is going to mainly be driven by our deltoids. So our deltoids is really a muscle that consists of 3 heads, and that's going to cover almost the complete shoulder girdle. So it's going to be like a hand or a glove that is fitting over your shoulder. And for flexion, we're going to mainly use the front side of our deltoids. Then we're also going to use our pectoralis major, that is the large chest muscle that we have, and that is also going to help in shoulder flexion. Besides that, we have the bicep brachii, so that is the bicep, really, the bicep muscle that is also connecting to the shoulder, and that's going to aid also a little bit with flexion. Now, moving on to extension, which is actually driving your arm backwards, and that is really done with the latissimus dorsi. That is your big muscle on the back. And then we also have the backside of the deltoids, which are going to drive that motion. So also the tricep is going to aid in shoulder extension, and that is the long head of the triceps, because that one is spanning across the elbow joint and the shoulder joint at the same time. So that's the only head that is covering those two joints, and that's why that one is going to help with shoulder extension. Now on to making a snow angel. Let's start with moving our arms upwards, and that is abduction. That we're going to do with the front and the side fibers of the deltoid muscle, but that we're also going to do with the rotator cuff muscles, mainly the supraspinatus and the subscapularis. So let me explain those two muscles actually. So if you look at the human body from the front, and we're going to use our X-ray vision to really look at that scapula. On top of the scapula you have the supraspinatus. That one is really laying on the ridge of our scapula, and on the front side we have the subscapularis, and those two are both going to attach to the humerus or the upper arm bone, and they're going to help in abduction. As it comes to adduction, we're going to mainly use the latissimus dorsi and the pectoralis major, so we're using both the front and the back to drive our arms back downwards. Moving on to the transversal plane, where we're going to do a little bit of a hug motion, although that's not really appropriate these days, but Depending on when you watch, if you want to hug, if you want to do some delt flies, we're going to use mainly the pectoralis major for bringing our arms closer together, and we're also going to use the front side of our deltoids for that. If we're talking about a horizontal abduction or moving our arms away from each other, then we're talking mainly about the rear deltoid fibers and also the infraspinatus. So we talked about our X-ray vision there, where we looked at the scapula. On top we had the supraspinatus, and on the front we had the subscapularis. On the back we have the infraspinatus. So the infraspinatus is going to pull our arm backwards if our arm is laying horizontally. Internal rotation, or turning your humerus inwards, is done by the subscapularis, also done by the pectoralis major, and a very shocker to most people is going to be also done by the latissimus dorsi, because the latissimus dorsi is a muscle that runs from the back of your body and it goes through your armpit and it attaches inside of your arm. So if you're going to pull from the back on your lat muscle, it's going to really turn your arm inwards. External rotation, or turning our arm outwards, is done by the infraspinatus and also our back fibers of our deltoids. What we see here with movement of the shoulders is that there are three muscles that are very important, and those are the most superficial muscles, and we're talking here about the pectoralis major, the deltoids, and the latissimus dorsi. So these are really the drivers of shoulder movement. So to aid in that movement, we're going to have the rotator cuff muscles that are really going to help and finish the job. So here you see that it's not just black and white. It's not just pushing is the pectoralis major, pulling is latissimus dorsi. You know that there's a spectrum there where both muscles are helping together simultaneously to perform an action. That is a good takeaway of this video if you just grasped one thing of it. Without the scapula, we are really limited by our movement of our upper arm. So the scapula is going to really just be moving in the frontal plane, so not in the sagittal plane, not in the transversal plane. And the great thing about it is that it's going to slide across the ribs. The first thing that we have is elevation and depression. So elevation is pulling our shoulder blades upwards, and that we're going to do with the upper fibers of the trapezius muscle, and we're also going to do it with the elevator scapulae. So these muscles are going to pull your shoulder blades up. If we want to pull them back down again, we're going to use the lower fibers of the trapezius muscle together with the pectoralis minor. Then we have adduction and abduction of the shoulder blades. So adduction is bringing the two shoulder blades closer to the midline, and that we're going to do with the middle fibers of the trapezius muscle, and we're also going to do with the rhomboids. So if the traps are laying more superficial inwards, we're going to have the rhomboids, which are really connecting the sides of the scapula together with the spine. And if they contract, they're really pulling the shoulder blades closer to each other. So pulling our shoulder blades away from each other or doing abduction is going to be done mainly with the serratus anterior. So the serratus anterior attaches to the hip. It doesn't attach to the hip. So the serratus anterior attaches to the ribs and goes inwards and attaches to the underside or the inside of the scapula. And then the last and most important part of the scapula is lateral rotation. So turning our scapula upwards so that we can extend the movement of the shoulders upwards. So that is going to be done with both the upward fibers and the lower fibers of the trapezius muscle, because they are going to counteract each other, and you have to see your shoulders as a kind of pivot point. So the upper traps are pulling on one side on the top, and the lower fibers are going to pull on the downside. So you're going to have a pivot motion of your scapula. And the muscle that is going to aid in this is also going to be the serratus anterior. So here you see the importance of having a stable scapula, because that is really the base of shoulder movement, and we want to keep it as healthy as possible. So if we're going to do heavy things, We want that scapula to be stable, because if it's outwards, our shoulder is in a more vulnerable position and we don't really want that. Thank you so much for watching, guys. I hope you got something out of it. I hope you liked this video. If you did, please hit that like button. Don't forget to subscribe if you haven't already. And if you want to encourage your peers or people around you, please share this video with them. It can help them tremendously. It will help me tremendously to get this content out there. So thank you so much. Don't forget to subscribe if you haven't already, and I'll be seeing you all in the next video. Peace!